Doctors of Reddit, what's your thank god they came in for a second opinion moment? I have a story of a friend who was severely mismanaged. For 2 years, my friend had been going to her GP complaining about migraines, bouts of severe vomiting, and dizzy spells. Every time, he would order blood work, then tell her she was fine. One morning, she woke up, and after a dirty morning with her husband, could barely stand. She was so dizzy and had such a bad migraine. She told her husband not to worry, sent him to work and had her neighbor drive her to the emergency room. She doesn't remember arriving. When she got there, she started acting erratic. They had to sedate her and sent her for a CT scan of her head. There, they noticed a huge mass in her brain. The hospital wasn't equipped to deal with that, so they sent her by ambulance to the nearest hospital that could, a 4-hour drive away. This hospital immediately sent her for an MRI. It wasn't a mass. They could actually see the mass growing as they did the MRI. No, she was having a massive stroke. She was immediately taken in for surgery. They put in a stent and had to remove most of the left side of her brain as it was all dead. Afterwards, she was in a coma for nearly 72 hours. They were uncertain if she would wake up, and if she did, if she would ever recover. Thankfully, she did. It took almost a year of physio and speech therapy, among a few others, but she has made almost a complete recovery. They even had their first child 8 months ago. Turns out, she had incredibly high cholesterol. With all the blood work that was done, her GP should have caught it. When she confronted him, he told her that her diagnosis was wrong, that she hadn't had a stroke and had made it up. She went after his license. Please tell me she got it. I've had a couple of gems, but the one that really sticks out in my mind actually happened about a month or so ago. A young mother brought in a 6-year-old to emerge. She was super nice and apologetic because she thought that she was wasting my time, because she said that her son had started to develop different spots all over his body and she has no idea why. My initial first thought was chickenpox, so I had some swords and shields up ready to go for the anti-vax debate. But she claimed that she had her son vaccinated at all stages up to that point, and upon closer inspection they were massive clusters of warts. Not uncommon, but because of how rapidly that they were growing, I ordered some blood work to make sure there wasn't an underlying cause, as kids' immune systems are pretty well equipped to handle that sort of thing. And I'm really glad that she brought him in, because he had a severely low white blood cell count which revealed a primary immune deficiency disease. Mid-30s man walks into my office with what looks like a black eye and a broken blood vessel in the front of his left eye. He went to his primary and it was simply assumed that he got punched or hit or something, and he was dismissed. He was noted to have high blood pressure, but a script for medicine was written and a follow-up in a few months. Gentleman comes in to see me to get another opinion on the matter and I look at him and immediately start the line of questions. How long has it been there? Do you have a headache? And when you plug your ears with your fingers, do you hear a whooshing sound? He had a cavernous sinus fistula, CCF. I sent him directly to the emergency room with his family of 4 in tow and he was in the ER within an hour of arriving. Saved his eye and possibly his life that day. The best news, he was a kitchen guy at my local diner which I frequent and they still treat me like royalty there when I come to eat. They all remember the time I saved one of theirs. This is a I wish I had gotten a second opinion story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially, and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is, that extra time almost certainly cost brain function. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway just because we might as well while she was there. She was a 50-year woman. Fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. Patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. 22-year guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did the usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. I think the other doctor should get his testicles checked too if he thinks lumps are normal. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test, so I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it. telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36-48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and ARQ was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high, not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, that is, pulmonary edema, hypoxia, ARQ etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he'd done goofed and that I would be talking to our mutual chief of clinical services about the incident. To be fair, it was all in his head, and possibly spine. A nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy crap. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest x-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The x-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. You would think a patient would start with well, since I was stabbed I have been feeling. From the time I was 13, I had a growth on my thumb. It became so big that it affected my piano playing. I went to the doctor about it, and he diagnosed it as a wart. That had been there for nearly a decade. He used acid on it. That hurt, and did nothing. He used an electrical instrument to burn it. That really freaking hurt, and again did nothing. I moved to the UK, and was at a dinner party a friend was hosting. She was a nurse, and many of her friends were nurses and doctors. One of the doctors, a surgeon, saw the wart on my thumb and became very excited. He called to his wife, a nurse, to come see. He told me that he couldn't diagnose me because I wasn't in clinic, but to make an appointment with my GP. I did, and was diagnosed with a neurofibroma, a type of tumor that develops around a nerve. I had surgery to remove it. It was the size of a lima bean. Thankfully, it was benign, but no wonder the wart treatments hurt like a synovitic. A bit of background. In my field of audiology, we have people licensed to diagnose not only hearing issues but balance disorders and other factors impacting listening and understanding. We also have another field who popped up when it was not considered as ethical for us to treat those more serious hearing issues. That is, with hearing aids, but they don't need the same doctorate level training, just barely high school or some college depending on jurisdiction. So I had a patient come in with a serious difference between left and right hearing, and this in itself is considered a red flag because both ears are exposed to the same things over time, and there are very few explanations as to why one would get so bad. The patient could hardly understand words on that bad side, and the better ear was pretty good overall. Just minor hearing loss, perhaps age related. Immediately upon seeing these test results, the aunt and I agreed to send this patient for an MRI of the head because something was off. The patient confirmed no MRI or medical treatment had been recommended in the past, and only hearing aids by this lesser trained hearing aid dealer, working for a popular US chain. The patient had been wearing these hearing aids already for a few years. The MRI results came back. Massive tumor on the hearing nerve. The hearing aid dealer is being investigated currently for malpractice, or more specifically a violation of state laws regarding red flags. I'm not a doctor, but my father was told a few years ago that he had bladder cancer. They were going to have to remove the bladder and some other bits and pieces, and that this doctor just told the guy to do the surgery for him. They started talking to him about where he wanted his port installed for his pee bag. That was the first time I remember seeing my dad cry. Luckily he has several clients who happen to be retired doctors and have become good friends over the years. One of them took it upon himself to review the tests and recommendations and told him that the doctor who recommended the surgery was either mistaken or lying to get himself more work. He went with my dad to several appointments with other doctors, and in the end they were able to treat the cancer without removing any organs, and it has stayed gone for several years now. My dad has a much better quality of life than he would have if he had listened to the first butthole and doesn't have to walk around with a bag of pee hanging off of him. We are all so grateful to his doctor friend who stepped in to help. Wife went to a for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to the doctor about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. 19 meters at a time. 33 now. I felt sick for about a week. Flu-like symptoms. Didn't want to eat. Just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen. So I go to one of those 24-hour clinics. At this point I'm slumped over. Can't stand up straight without insane amount of pain. Just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home. Drink fluids. Sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER. Against my wishes, of course. After a few minutes at the ER, they determined my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6-7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. Former volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent. We weren't sure if treatment would take effect in time to prevent it. Declared code blue. All hands on deck. Place went from a quiet, empty to sheer chaos in a few minutes. There is no doubt in my mind that that gut feeling saved his life. At one of my practice placements, I conduct psychological evaluations for children and adults referred by the court system, typically following court-mandated removal. The referrals almost always ask for differential diagnosis and treatment recommendations. Many of the children have previous psychiatric diagnoses and are prescribed a slew of medications. In this sense, the psychological evaluation is a comprehensive second opinion that requires me to sort through previous diagnoses, background information, and data from the assessments I administer. I would say that the most common misdiagnoses that I see among children are bipolar disorder and attention deficit hyperactivity disorder, ADHD. Oftentimes when a child has a traumatic history, as many of my clients do, they exhibit signs of hypervigilance, avoidance, emotional dysregulation, and behavioral issues. The hypervigilance looks like the hyperactivity found in ADHD and the hypomania mania in bipolar disorder. Emotional dysregulation and avoidance, for example, social withdrawal. It's easily mistaken for the depressive side of bipolar disorder and can also result in disruptive behaviors characteristic of ADHD. There are also some serious repercussions of prescribing children psychotropic medications to treat psychiatric disorders they do not have. To answer the question directly, it's rewarding when you have the opportunity to help clarify a child's psychiatric diagnosis and ideally write treatment recommendations that improve their prognosis. I'm a fan of comprehensive second opinions, especially in the arena of mental health. Only a medical student, but I had one in my GP rotation that I won't ever forget. I'm taking consultations but have the real GP on backup to prescribe and handle more delicate tasks. 60s lady comes in with bleeding again. She said she had hemorrhoids before and got treated by the last GP perfectly fine. No problems. Bleeding stopped and now a year or so later has started again. I question her and it seems, by all accounts, to be the same problem. She just wanted to double check with the GP before we went and got the creams and such. I offer to examine her to make sure and she gives me a "oh go on then." Her back passage is normal but I figure maybe the problem has resolved, as I can't see any blood on doctor. As an afterthought I ask the GP, female, to take over for a speculum examination. PT nice enough to let me look. No hemorrhoids, significant visible cervical cancer. I can see the outgrowth through the os. Frick. I almost let her go without offering speculum and vaginal examination, since I figured ladies have a good idea of where stuff is coming from. GP definitely would have stepped in if I'd sent her out, but dang, if it wasn't for her and my iffy feelings on the matter, who knows. Thank God she came back to double check. We reckon first doctor must have missed it. My son was about 1 month old and was crapping small amounts of blood, and getting worse. Pediatrician ignored us because new parents. Second trip to pediatrician and I refused to leave. I said something is wrong and we aren't leaving. About that moment he crapped his diaper full of blood and the pediatrician freaked out and sent us straight to emergency. The doctors there ordered several different bacterial tests. Just before they sent the test upstairs, an old doctor came in, asked us a few questions and told the tech to test for one more type of bacteria. That was the one. C. diff. 25% fatality rate and treated. Worse in infants. Thank you old man doctor. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.